Because you'll all be like, what the hell is she treating? All right, go ahead. So Alicia is a 32-year-old hairstylist who runs every day. She runs varying distances from 2 kilometers to 20, depending on her training schedule. Alicia works at the salon 6 days a week, on her feet for most of the day. She likes to do her runs before work after she drops all 3 children off at school. Lately, Alicia has been shortening her runs, going no longer than 10 kilometers. About 4 weeks ago, she began experiencing pain under her left knee after running, but now it bothers her at both the beginning and after her runs, mainly on distances that total more than 5 kilometers. Alicia doesn't have pain at work, but she does occasionally feel pain in her left knee when she kneels down to play on the floor with her kids. Her left knee pain is mainly present when she runs, before and after running. Postural analysis. Bilateral pes planus, slight flexion in the left knee, weight bearing to the right side. Range of motion of the knee. Active free is within normal limits. Passive relaxed, pain on flexion of the knee with overpressure. The pain is located at the tendon. Active resisted, pain on extension with submaximal resistance. Pain is located at the tendon. Palpations. Tender at left patella, hypertonicity in quads, slight warmth felt over tendon, no edema present. Testing. Waldron's, pain at tendon upon repeated squats, negative. Provocation, pain on palpation of the tendon and quad, pain on passive stretch at the tendon of the quad, pain on active resisted of the quad at the tendon, positive. Fluctuation test of infrapatellar bursa, negative. Eli's, pain at tendon, slight flexion of the pelvis, positive. Please perform a treatment for chronic grade 2 patella tendonitis.
Yep. Minute 55.
Okay, I've washed my hands. Do I still have consent to perform a treatment?
Yes.
Yes? So I'm going to be on draping your anterior leg. I want to just remind you of our pain scale. We're going to be working on a pain level of 0 to 10, where 0 is no pain at all, and 10 is the most excruciating pain you've ever felt. Today, I don't want you to feel anything above a 6, except when we do things that are a little bit more aggressive. Do you understand?
Yes.
Do you have questions?
No.
Like a boss.
So I would have started my treatment working on the hamstrings, and then I'm going to preheat the area of the quad group and the patella tendon before I start. So that's been on for about 5 minutes, and I'm going to remove it, and I'm going to begin my treatment with some fascial work. I'm first assessing the quad group and the IT band group, and also down across the patella. And I'm going to start with just some glide. Are you videoing me?
Yeah.
That's fine.
I should have done that.
Hey, Lisa.
So fascial work is used to reduce any restrictions within the fascia. Fascia surrounds all of our muscles. It's connective tissue between the skin and the muscle, and also between muscle groups. You can do gliding, spreading, or cross hand. Right now I'm just performing some gliding. It's important to reduce some restrictions just because this will decrease any stress that's placed upon the tendon. So I'm just reassessing, and things seem to be loosened up. And I'm just going to come across the tendon just using some thumb spreading. You okay there for pain?
Yeah.
So with your patella tendonitis, what's happened is you've just placed a lot of repetitive stress on the tendon, and there's been some micro tearing that's occurred. Initially you were about a grade 1, and now we've moved you into a grade 2 because you're getting pain before and after. Grade 3 would put you where you'd be getting pain during your run as well, but you're not experiencing that pain right now, right?
No.
So I'm going to perform a repeated effleurage and petrissage, warming up my tissue and allowing me to find any restrictions within the muscle. I palpated some hypertonicity, so I want to make sure that I reduce any of that hypertonicity because it's going to cause more stress on the tendon. As I work deeper, I'm going to change my direction and work towards the patella tendon so that way I'm not putting too much drag and stress on that tendon causing more tearing. While I'm doing this, I'm checking for any kind of trigger points or adhesions that might need to be worked out. And I can feel some adhesions along that tendon, which we will get to. I get time?
Your phone looks
5 minutes and almost 6 minutes.
So I am feeling a little bit of a taut band at the upper portion of your rectus femoris, which is your main central quad muscle. This tends to cause referral pain right into the lower knee, so right where that tendon is. So I'm just going to see if I can find the most tender spot. How's that there? Tender? Good. So what I'm going to do, I'm going to warm that up and I'm going to perform an ischemic compression to release that trigger point. Trigger points form in muscles for various reasons. Yours is probably from the stress and repeated use. And what I'm going to do is I'm going to apply a pressure. We're going to go back to that pain scale, 0 being no pain at all, 10 being most excruciating pain. Don't read that. And I'm going to bring you up to about a 7 this time. Okay, we're going to hold it. You should feel it reduce down to about a 2 to 3. When it does that, we're going to increase the pain again. Any questions? Do you have consent to do that technique on you? Yes. Okay. So do you feel the referral down into your knee? Yes. Okay, so I'm just going to wipe off this excess lotion here so that I don't drag. And I'm going to apply pressure and let me know when you're up to about a 7, 8. Okay? And keep breathing through, nice and slow. When you're down to about 2, 3, let me know. Okay, and I'm going to apply a bit more pressure at that 7, 8. Okay? And you're feeling that refer down into the knee?
Yep.
And when you're at a 2, 3? Okay, so I'm going to come out slow. And then I'm going to flush. So because I'm not in the best position to put a stretch on this, and also because the stretch of the quads places a lot of stress on that tendon, I'm going to just perform a manual stretch after I flush. Any pain? So I'm continuing with my petrissage.
8 minutes.
So what I'm going to do next is I'm going to do a little bit of frictioning on the tendon itself. Today I'm going to start with just parallel frictions, just working with the tendon. So I'm going to have you bend your knee slightly. And I'm going to be working along the tendon, okay? It's going to feel a little sore. We're probably going to be working up to about an 8. Any questions? So frictioning will help to break down these adhesions, and we want to try and get them to re-scar in a healthy manner so that they're not